Thank you very much, John. I, I should own up to the fact that I'm not actually an investigator in CBD, but it has become a very interesting part of my practice, especially when patients ask more about CBD and cannabis in general at the clinic when it comes to managing their arthritis and the pain associated with the disease. So over the next 12 or 15 minutes, what I'm going to do is just talk about cannabis and CBD in relation to what it is, where it came from, what the internet says about cannabis and CBD, what studies are out there, whether or not you should use cannabis products, and then if you do decide to use CBD, how you might approach using these medications or supplements. So cannabis is a flowering plant. It's known as hemp, Mary Jane, bud, weed, and if you watch movies over the years, you'll hear many other different terms for it. It's a member of the Cannabiceae family of flowering plants. There are at least 170 different species in this family, and the ones that come up in discussions about cannabis usually center around Cannabis sativa, Cannabis indica, and Cannabis ruderalis. And Cannabis sativa is probably the one that's most frequently discussed in terms of cannabis and cannabis products. So cannabis plants can grow to be very tall. The sativa plant can grow to 4 meters in height, and it tends to be very spindly. And the part of the plant that's really important from the point of view of cannabis products is the flower of the plant. And it's the female sativa plant that's most important when it comes to isolating the products that we have available now that cannabis is legal in Canada. Where does it grow? Well, it grows in the wild in Central and South Asia. And this is a picture that I stole from Wikipedia, and it's from Islamabad in Pakistan. They obviously haven't got around yet to building the embassy for Afghanistan at this site because they're probably too busy growing weed. But it's available across those parts of the world in the wild. So cannabis sativa has been used in medicine for thousands of years. There are recorded references to it in Chinese medicine back in 4000 BC, in Indian medicine, meaning East Indian medicine in 1000 BC. And interestingly, it was brought to the West by an Irish physician. So you have an Irish physician talking about a product that was brought to the West by another Irish physician a few years ahead of me, although he's not that much older, or younger, I should say. He worked, William Saughnessy was born in Limerick in Ireland, the city my wife is from. And she says there are still Shaughnessy's there who are involved in medicine. Although many of them are probably not directly related to the late William Shaughnessy. So he was a member of the British Army Medical Corps, and he worked in India in the mid-1800s. And he brought cannabis back to the West because he had seen how it was used in medicine in India and how effective it could be in certain individuals. As a recreational drug, or a recreational product, I should say, it's been legal in Canada since October 2018, and we were the second country after Uruguay to legalize cannabis. And we're also in the top 4 for the use of cannabis products and cannabis in general, along with Zambia, the US, and Nigeria. And cannabis can be grown, cannabis plants can be grown and made to produce certain products. So for example, we have colleagues at the University of Lethbridge with whom we were planning to do a study on cannabis or CBD in the management of pain and rheumatoid arthritis, who have been growing cannabis plants for many years through a license with the Canadian government. And you can grow these plants to have a heavy level of CBD produced, or to have THC, which is the part of cannabis that causes people to have psychoactive responses to it. But there are other chemicals present in all of these cannabis extracts that also have to be looked at when you're looking at products. And then in the States, it is legal to grow hemp, which has very little THC in it for the production of hemp fibers, which are used in many different areas. And also products of hemp can be used for skin products as well. The main feature of the cannabis that is grown for hemp is that it has to have a very, very, very small amount of THC or CBD in it. One interesting piece of knowledge that I generated through working with Dr. Jason McDougall, who was a member of our McCaig Institute until he moved off to Nova Scotia a number of years ago, was that our bodies have natural cannabinoids, and we have receptors for these cannabinoids in our body. So on the left of this, you can see the natural or endocannabinoids that we have and what their names are. I'm not going to try and pronounce them. And then you have the phytocannabinoids, which are the cannabinoids that are extracted from cannabis plants. So the discovery of the endocannabinoids is not that old. It's just over 30 years ago that people started to become interested in cannabis receptors in the body. And what we know is that they play a role in maintaining homeostasis or balance in the body functions. Exactly how the cannabis does this is not clearly understood. But we have two different types of receptors. We have CB1 and CB2, but there are other ones that are being discovered over time. And it's thought that these endocannabinoids play a role in some disease states, either positively or negatively. So there have been studies done looking at animal models where the animals have been infected with different organisms. And in some cases, the animals did well when they were treated with cannabinoids. And in other studies, they did poorly. So it depended on the organism that was infecting them. But again, these studies are in a very infant level, not infantile, but in their infancy, because we are very much in the early phases of studying cannabis and cannabis products in humans. The CB1 receptors are present in the brain, lungs, the vascular system, and the CB2 receptors are present in the spleen and bones and the immune system. So this is where the interest in CB and cannabinoids comes from the point of view of studying them in immune conditions like rheumatoid arthritis. If you look at how these products that we have from cannabis plants work, THC, the part of the cannabis plant that causes the psychoactive behavior, which causes people to get high, there's many of those receptors are present in the brain. So it's not surprising that when people smoke cannabis that they can have high out of the product. You see, the CBD receptors are not as tightly bound to CBD as the THC ones are, but the CBD can play a role in reacting with pain receptors in the body and help to reduce pain. Now this is just a graphic of where we look at the receptors. So CB2 receptors, which is what CBD will react with, are present on immune cells, and the CB1 receptors are present on neurons. But both products, the THC and the CBD, will interact with both neurons and immune cells. We're just not at the level yet of sophistication of knowing exactly how these products work in conjunction with each other. So lots of studies are ongoing that have not been published yet. So it's interesting that we're talking about hip joints, and Alf here has obviously he'll have hip joint problems as he ages, but he also has difficulty rolling his joints because he has osteoarthritis in his hands, which makes it difficult to function. So Alf is having troubles on at both ends. So what does the internet say about CBD treatments for arthritis and GUGO? Well, I did a search using the Google search engine and found 2,980,000 results in 0.44 seconds, which is much faster than the results of the voting in the US was counted. Maybe they should have asked Google to do it for them. But what does this mean? Well, for me, it meant that my connection to the internet through Shaw was good. It doesn't mean that this information is real. It doesn't mean that it's all being studied, because when you look, when you look for real studies, I mean, by that I mean studies where there have been different populations studied over time to see how effective these products are in treating arthritis or the pain associated with arthritis, there are very little data. And these studies, can you trust them? Well, generally speaking, if your studies are published in peer-reviewed journals, you can trust them. But when they're just anecdotal studies, anecdotes are not data. They're anecdotal. They're good for the patient who wrote the information into the internet through a web page or a blog, but for the general population, they don't really apply. There was one reference study which looked at osteoarthritis and the pain associated with it being attenuated by CBD. And that looked great. And especially when I saw that Dr. McDougall, my colleague who is now, as I mentioned, working in Nova Scotia, and this was published in a well-respected journal called Pain in 2017. But then when you actually look at the whole title of this talk, or of this study, I should say, the attenuation of early phase inflammation by cannabidiol prevents pain and nerve damage in rat osteoarthritis. So if you have any rats in your house, although there are not that many rats in Alberta, I understand, you could treat them if they have osteoarthritis in their hips with some CBD, and they won't limp around your house any longer. But it doesn't, it just shows you how you have to be careful what you read on the internet before you decide that you're going to use a product. This attenuation of pain and osteoarthritis, then when you put the whole thing together, reminds me of the ancestry.ca ad on the television, which says my grandfather was, and then at the end it goes British, and then you find out my grandfather was a soldier in the British Army and he was presented with a medal by the British for bravery. So you have to look at the whole title of the talk, of the article. There has been a preliminary assessment of the efficacy, meaning how well it works, the tolerability and safety of cannabis-based medicine in the treatment of pain caused by rheumatoid arthritis. And this was published in a respected peer-reviewed journal in 2006. The journal is Rheumatology. But it was a very small study. There were 58 patients. It was very short term, of 5 weeks. And as any of you who may have rheumatoid arthritis or who treat rheumatoid arthritis will know, rheumatoid arthritis is a chronic disease. It's not a one-off. And it's there for a long period of time. Patients have symptoms for a long period of time. And what they used in this study was an oral spray of both THC and CBD. And there was a small statistical difference between the groups in favor of the cannabis product, reducing the amount of pain and how well patients felt. And what they suggested was that a larger study needed to be done to see if this initial pilot information was actually was true in the sense that it would hold up over a longer period of time. So there are no large randomized studies of cannabis products in arthritis. And there are many reasons for that. If you were a cannabis producer, you don't have to do studies to show that your product is useful, as long as you don't make any claims to its medical usefulness. Cannabis producers do not have to do studies. They just have to show that their product is safe. Companies use testimonials, anecdotal reports to support their products. Clinical studies are very expensive. You have to have investigators who are interested in doing the study. You have to have investigator staff who are willing to run the study with the investigator. There are medical legal issues that have to be addressed before studies can be done. there are ethics approvals that have to be achieved, and you have to have enough people in the study to show that the product that you're studying is going to help. And you also have to have a specific product. So the product has to be identifiable and has to be reproducible across a period of time by the company who are studying the medication or the product. So when a patient asks me in clinic, should they use CBD for managing their pain? Well, the first thing I like to tell patients is that I don't have good data to share with them on the effectiveness, the amount that they should take, the safety of the medication, or the duration of therapy that they need, or how long basically they should take the drug. As I mentioned, testimonials and anecdotes are not data. But we have colleagues who have a big interest in CBD products and who will be able to advise patients on whether or not they should try these products, or what products to try. What products have been shown to have been consistent in what they say is in their product. If you are going to take a CBD for your pain, what should you know? You should know what you expect. So I presume most patients would want to know if it will help the joint pain. They want to know if it has any adverse or bad effects. They want to know how long they should remain on it. They will need to find a brand they can trust. So again, referring back to the physicians who work at cannabis clinics, who have a background in working with many of the companies who produce these products, they can give them advice. It's important that the brand you choose has consistently produced a quality product. Again, reputation is important and purity is important. Manufacturing changes can affect the quality of the product. So if a company is making the product in one way for a period of time and then switches over to what looks like a more effective and less expensive way of making the product, they have to be able to show you as the consumer that the product is still as good as it was when they were making it the old way. And then the other thing you can do is you can look at patient comments online, or you can ask a friend if they've tried the product. And it's interesting, even when we prescribe medications such as biologic therapies, which are used in the treatment of patients with severe rheumatoid arthritis, we will often be told when we discuss with the patient, which of these products would you like to try? Have you read anything about them? They'll tell you about a friend or a friend of a friend or a colleague at work who has tried one product and they want to try that one. So that type of person-to-person contact is really important when people are trying to decide what kind of CBD product they would like to take. And then when someone is deciding to take a medication, in our world, we build up the dose. We know what dose we would like to start with. We know what manipulations we can make to the dose. And the same thing should apply when you're using CBD, for example, for the treatment of your joint pain. And in most instances, the doses are measured in milligrams, and it depends on the weight of the patient and on the severity of the pain. Oops, sorry. What you should also know is what are the adverse effects. With CBD, all the adverse effects tend to be minimal. You can have a dry mouth. Some people feel a bit dizzy and lightheaded when they take particularly the higher doses of it, and it can make some people feel drowsy. What you also have to be aware of is how much THC is in the product. Although CBD oil and the way it's produced, it can come in capsules or it can come in a dropper, there will always be a little bit of THC. You need to have as little THC in the product as possible, because the THC is the part that causes psychoactive activity. And then you should also know how long you want to take this product. So for example, when we're treating somebody with rheumatoid arthritis, we expect a medication that we use, like a disease-modifying therapy, to work within 3 months. If that doesn't happen, then we move on. And I think the same thing with osteoarthritis. If somebody is going to use an anti-inflammatory medication to help manage their pain, we will ask them to take it for 2 to 4 weeks to see if it's effective. If it's not effective, again, we move on. So patients should apply the same rationale if they're going to use CBD. There's no point in taking something over and over again and expecting a better result if you're not getting any result after you've been on it for a period of time. It's a waste of money. All right, that's as much as I'm going to say, and we will be entertaining questions at the end, so feel free to ask any questions you want. Thank you for your attention.